What's up, everybody? Dr. Mike here. Have you ever wondered how smart you really are? Well, get ready to put that brain power to the test with our CNS infections quiz. We're diving deep into the world of encephalitis, cerebral malaria, and HIV-associated CNS infections. Whether you're a medical student, a healthcare professional, or just someone who loves a good challenge, this quiz is for you. So, grab your thinking caps, get those fingers ready to pause, and let's see what you've got. Let's start with the basics. What are the 3 hallmark signs of encephalitis? Think carefully, this one's important. In the United States, one virus is notorious for causing encephalitis. Can you name it? Herpes simplex virus loves a particular part of the brain. Do you know which one it targets? Chapter 4, First Line of Defense. Time is brain. What's our go-to treatment for suspected HSV encephalitis? Chapter 5, MRI Findings. We're looking at an MRI. What's the telltale sign of HSV encephalitis? Chapter 6, Arbovirus Alert. Which one of these is an arbovirus known to cause encephalitis? Rabies encephalitis has some classic symptoms. Can you identify one? How long do we typically treat HSV encephalitis with acyclovir? Encephalitis isn't always viral. What's a non-viral cause? Some conditions masquerade as viral encephalitis. Can you name one? What's the main culprit behind cerebral malaria? Let's debunk a myth. Which of these is not how cerebral malaria works? What's the defining clinical feature of cerebral malaria? We need to act fast. What's the first-line treatment for cerebral malaria? Sadly, cerebral malaria can have lasting effects. What's a common one in children? So how do we usually diagnose malaria quickly and reliably? Well, let's dive into it. Cerebral malaria can disrupt metabolism. What's a common complication? Alright, let's talk prevention. Which of these won't protect against cerebral malaria? Let's find out. What helps Plasmodium falciparum stick to blood vessels in cerebral malaria? Which finding is not typical in cerebral malaria? HIV can directly affect the central nervous system. Which of these is not a direct effect? At what CD4 count are HIV patients most vulnerable to toxoplasmosis? What's the most common life-threatening fungal CNS infection in AIDS patients? How does CNS toxoplasmosis usually appear on a contrast-enhanced MRI? What's our first-line treatment for CNS toxoplasmosis in HIV patients? Pyrimethamine and sulfadiazine pills. And what sneaky virus causes PML in HIV patients? The JC virus. Which CNS infection in HIV patients often involves cognitive decline and retinitis? That would be CMV Encephalitis. What do we typically see on MRI with progressive multifocal leukoencephalopathy? Which of these is not a typical clinical feature of PML? How do we typically manage CMV encephalitis in HIV patients? What's not a typical CSF finding in cryptococcal meningitis in HIV patients? What's the gold standard test for cryptococcal meningitis? What's the go-to maintenance therapy for cryptococcal meningitis in HIV patients? So, what serious complication of cryptococcal meningitis needs careful management? At what CD4 count do we consider fluconazole prophylaxis for cryptococcal meningitis? What's the most effective way to prevent opportunistic CNS infections in HIV patients? What's not typical of TB meningitis in HIV patients compared to HIV-negative patients? How does JC virus-associated PML typically present? What's the recommended first-line treatment for PML in HIV patients? What can happen during IRIS in HIV patients with CNS infections? What's the key difference between encephalitis and meningitis? Which of these is not a common sign of HSV encephalitis? What clinical features are characteristic of Japanese encephalitis? What's the most sensitive test for diagnosing HSV encephalitis? What's the grim reality of untreated HSV encephalitis? What's at the heart of cerebral malaria's pathophysiology? What's important to remember about CMV encephalitis in HIV patients? Viral encephalitis CSF. What cerebrospinal fluid finding is not typical in viral encephalitis? Managing intracranial pressure. How do we manage increased intracranial pressure in cryptococcal meningitis? Necrotizing encephalitis. Which virus is infamous for causing necrotizing encephalitis, especially in the temporal lobes? Stay curious, stay informed. That's it for our CNS infections quiz. How did you do? Whether you aced it or learned something new, remember that knowledge is power when it comes to medicine. Don't forget to smash that like button if you enjoyed the quiz, share it with your friends and colleagues, and subscribe to my channel for more awesome medical content. Until next time, stay curious, stay informed, and stay healthy. Great job on completing the CNS infections quiz. We hope you found this informative and helpful. Don't forget to like, share, and subscribe for more medical quizzes and educational content. See you next time.